from where you went, and we can just edit them
Whatever.
together.
Action.
Okay. I'm not suggesting that there isn't a benefit to counseling and to help from a doctor. Far from that. I think that our contribution is very valuable. I work in a partial program most of the time now, and I figure out what's wrong with people in terms of diagnosis and help them understand and agree, and then I work with the medicine. I just feel that even more important than that is you doing your part. And if you don't do your part, no matter what I do with the medicine, it's limited in benefit. However, what's happened over the years is insurance has shrunk down the time that we have. As a psychiatrist, I used to have 2 hours for an initial appointment, and then I would see you for an hour every week. I would do the medicine and I would do the counseling. Now the counseling has been given to others, and we've been down to hour at the most for initial, and then see people occasionally. You have to help your doctor and your counselor help you. With the counselor, stop to think, what can they do? They can let you vent. They can help you see things you can't see yourself. And they can help you identify patterns. Venting is important. That if we keep things in, we're liable to explode. So it helps with that. As you throw things out into the air and pay attention to what you're saying, you learn things. When I used to be a counselor, I would have people tape the session and make sure they listened to that before they came back the next time. And I'd say, what'd you get out of that? First, they'd look a little embarrassed and say, I kind of whine a lot. I said, oh, I'm glad you heard that. And does that help you? Well, not that much. And so they learned things about how they present that they weren't even aware of. They might identify some patterns in them. So venting is useful. Also, very often you get so close to your problem you can't see it. I used to live in a small town in Ohio where my neighbor's yard was completely full of dead cars. Maybe 15 of them out there. I think he thought he could take parts from this car and add it to parts from that car and eventually get one that ran. I'm not sure what. He couldn't see it. His yard looked fine to him. Now I'm sure when he first moved in there were no dead cars. Then there was one, and then there was two, and they added up slowly. Now there were 15, and the place looked like a junkyard. And our lives are like that. Our problems come on slowly and gradually. We might copy them from our family of origin, from the people around, and it's hard to see. Counselor can be really helpful saying, here's a pattern. But if you recall my quote from Einstein, that you must change how you respond to life if you want to get a different result. And that, I think, is the most important thing that a counselor can do. When this happens, here's how I respond. Do I look at things and overreact? Do I not see it in the first place? What do I feel? Is it helpful? What does it lead me to do? I'll give you an example. There's a pattern called codependency. As far as I can tell, every good counselor I've ever met is codependent. We go into this field, we're going to help other people. They're going to appreciate us, and then we can appreciate ourselves. It's not that the codependent depends on anyone to do anything for them. Far from that. They're always running around doing things for others. They just connect their worth to the affirmation and approval they get from other people. Unfortunately, no matter how much approval they get, it's not enough. And half the time, the other people learn that hold this carrot out in front of you, that someday they might appreciate you, keeps you working your head off trying to please them. And you burn out. So, when others in your life are suffering, are angry, are in turmoil, the codependent jumps in to try to fix them, hoping to get some appreciation, and what they get is used and burned out. That's a pattern. Then your counselor has to help you figure out what would healthy look like. I used to supervise this one counselor. She got a lot of codependent ladies coming into her practice. They were the nicest, most helpful ladies on the planet. And after 3 sessions with her, they were beginning to work on their problem. And they had to come and see me to find out did they need medications or not. And they were the meanest people you would ever want to meet. What do you mean you can't see me at 2 in the morning? That's when I get done work. And blah, 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 blah. And I was tickled pink because they weren't being used anymore. They were just mean and nasty. They had to learn something called assertiveness, and it takes time. So your counselor helps you figure out what are your patterns and what would healthy look like, and keeps you at it as you practice these healthier responses. Now, the problem with the way your brain is wired. When you go to sleep at night, your brain does not remember patterns. It remembers a few facts, a couple of snapshots. When you try to remember what actually happened yesterday, it puts together a story. Some of it may be true, some of it may be exaggerated, some of it might be less than reality. I find when angry people come in to see me, I'll say, "Why are you here?" "Well, my wife says I have an anger problem." "Oh, so your wife is overly judgmental and she's the one who should be here?" "No, I probably do." "Okay, well, give me an example." "Well, I can't think of any." "Okay, so your anger problem is so bad you can't think of a single example, but your wife is so nasty she make you come and get help anyhow?" "No, I probably do have a problem." "Well, give me an example." "Well, the other day I came home and I was tired and I expected supper to be ready and the place be, picked up, just sort of organized, place I could recover. And it was trashed and it was noisy and supper wasn't ready. And I said, 'Dear, it'd be nice if the place was clean.' And she threw some shoes at me." "Oh, I told you, your wife has a problem." So I call up the wife and she says, "Well, did he tell you the other part of the story?" "No." "Did he say he picked up the couch and threw it to the front window?" "No, he forgot to mention that." And that's what we find is that when we go in to see the counselor, if we haven't kept track, it's been 2 weeks, we make ourselves look better or worse, or it's vague, and they can't give us decent help. So here's the deal. Before you go to sleep, you write down one thing. Come on. One example of a pattern. Handled well. We're not here to yell at ourselves. We're here to do better. And remember, 3 times a day, you're supposed to find something to give yourself credit for. And it doesn't hurt to give yourself credit for responding to life in a healthier pattern. So you should be able to find one thing to write down. And then, like those ladies trying to figure out what assertiveness looks like, you need to write down one example of something you weren't quite sure how to handle. Take that notebook with you to your counselor and you'll get much better help. It's also important to help your doctor help you. Doctors don't have much time. My friends that were helping me do this program, they pointed out that one of them, their parents are both doctors, and they have an exact length of time for appointments. It's like 7.2 minutes or something like that. Insurance keeps squashing us down to shorter and shorter time. If you help your doctor help you, if you help your counselor help you, you do better. Your first job is to tell a clear story. I have people whining all the time on how the diagnosis changes. I'm sorry to tell you, there really is no such thing as a diagnosis, because every human being is so unique. We're all slightly different, whatever labels put on it. You are a combination of the following things. First, we want a clear story of your genetic tree. We don't want to know that Aunt Sue had some sort of problem. If at all possible, you want to know, was it depression? Was it anxiety? Did she have psychotic breakdown? What was the treatment? Did she have to have electroshock therapy, go to the state hospital? The more information on what runs in your family. Alcohol is important. Most people try to treat bipolar, for example, with alcohol. I already pointed out that bipolar is destabilized for a month if you get drunk, so it's not a wise move, but it's cheap and universally available. And when you tell people I got bipolar, they look at you funny. If you say, I went drinking, they don't think it's all that big a deal. So people, what runs in your family tree? It helps us be a little bit more clear what we're probably dealing with. Then we want to know about your manufacturer. Was there any problems with you born early? Was mom using substances, drinking? Was she anorexic and not eating? It's important to know about your manufacturer. Write it in your story. You need a notebook with this in. We want to know When you're a child with that brilliant child brain, brilliant but ignorant, trying to make sense out of life, what were the stresses you went under, and what were the conclusions you drew to try to make sense out of it? Like I said before, that's almost universal for children to blame themselves if their parents are messed up. We also think, well, the problem here is I'm too pretty, and that's why I was molested. So I'll see if I can make myself ugly, and then it won't happen. Or never trust anybody, because if you get close to them, they'll hurt you. Don't get close to anyone, they'll probably die. And there's these endless conclusions, and you need to sit down and say, what are the things from my childhood that control me in the present? Otherwise, it's like trying to drive with no rearview mirror. You change lanes or hit the brakes, you get in an accident. You need to know, how does the past control me in the present? Now, I don't want you to drive staring in the rearview mirror. That would be foolish. I don't want you to pull off to the side of the road and park so that you can stare in the rearview mirror to your heart's content. That wouldn't get you anywhere. But we do need to know, how does the past influence my decisions and rob me of free will in the present? Then we need to look at the diagnosis. You must be really clear on what's wrong with you. When did the symptoms start? What makes it worse? What makes it better? You need a whole page on medications. Patients think the system will remember what medicines they've taken, how much, how long, with what, and why was it stopped. It's not true. You need a list of the medications. So let's just review that. First, there's family tree issues. We're interested here in genetics and how that connects. Then how about manufacture? Oops. Then we want to know about your childhood conclusions. Oops. Hey, I made it on. Now we want to know about symptoms and medications. And the last part of your story is to sit down and ask yourself truthfully, what are you running around thinking your future will look like? There's no hope. I've tried everything. Nothing will ever work. Was there a family member who had a similar problem and they wind up dying in the state hospital? Is that what's going to happen to you? You need to look at your future story. That's part of your total story. And change it to be more positive. I'll give you an example. I had a patient come in and they had been on Wellbutrin. And I looked at their symptoms and I said, you know what? You don't have much norepinephrine in your head. You don't have much dopamine. Wellbutrin helps with norepinephrine and dopamine. What was your experience with that? And they think, and they say, you know what? I did really well on that stuff. Okay, so why aren't you on it? Well, and they look at me a little sheepish, you know. I thought I was cured, so I stopped it. Okay, well, that's understandable. I got no problem with people being normal. The problem is if we don't fight our normalcy to be healthy. So what happened? Well, I cracked up and I wound up in the hospital, and the doctor said, what were you on? I told him Wellbutrin, and he said, well, must not have worked. We're going to try Paxil. Well, Paxil doesn't do the same thing as Wellbutrin. You got to be helpful to your doctor and give him good information. Or they'll tell me I was on this little green pill, and I think I took it for 2 months, and I think I forgot it half the time, and I don't know if I took anything else with it. Well, that's not much help. Very often I get people who, because they've had care for a long period of time, have literally taken everything, and we got to start all over again. And I don't trust that they were given enough with the right combinations, long enough, and faithfully enough. And if you take an antidepressant, for example, and you don't take it regularly in high enough dose, it doesn't do any good at all. Sometimes we'll restart a medication and find out why it was stopped, because they have some side effect and they say, oh, that's right, I forgot that smoke came out my nose or whatever it was, you know. No, it's your responsibility. If you think that the system is going to remember this, good luck with that. Your doctors are always moving. Just like most people have to get a new job about 5 times in their life or more nowadays, you're going to go through a bunch of different caregivers. You have to provide the continuity. Aeons ago when I was in medical school, they talked about the importance of continuity of care. Well, it's not available anymore. You'll move, we'll move. Even in the same time, I know psychiatrists when they're younger always moving to a different job, thinking the grass is greener on the other side. Finally, they get old and stick with the same grass because they realize they ain't any greener down the road. So, help your doctor help you. Okay, the last thing I'd like to do is give an overview of medications. We've talked about why you have to do your part. We've talked about the importance of counseling and work with your doctor. But why take medications? Well, let's say you broke your leg and I break my leg. And you're going to be tough and you're going to be macho and you're not going to use any stupid walking cast. Me? I'm going to be dependent. I'm going to put on a walking cast. Now answer me truthfully. Who is going to get to walking sooner? Well, I will because I got some support. And whose leg will shrivel faster? Yours will because you're not walking on it. And whose leg is going to heal faster? Mine, because putting a little pressure on it helps. And whose leg is going to heal up crooked? Yours? No, it's not wrong if you got a broken leg to wear a helpful thing. And we get into this thing called the vicious circle, where people are too sick to do the work to be less sick. You go to a depressed person and say, I want you to get up a half hour early and jog around the block. They say, get up a half hour early. I can't get up till noon. I'm lucky if I can walk to the bathroom and back. The same is true with anxiety and depression. If you don't have enough serotonin, norepinephrine, dopamine in your head, you get up in the morning, probably haven't slept that well, but you made a little bit, but it gets pulled into this sinkhole of worrying about things. And it eats up whatever little serotonin you have. So how do you learn to quit worrying about things? How do you let go of sweating the big stuff in the small stuff when you don't have enough serotonin? So I get people who agree, the way I've been coming at life has burned me out. This would be a better way. I need to go to counseling, but they just can't do the work. So we prop them up. Let me explain, if you have depression, what these medications do. Is that going? If you recall, when the cortex wants you to calm down, it sends a message down to the end of a serotonin nerve. And it dumps out 100,000 to attach 1,000 to the next nerve and get the result. Anything less than 1,000 will not work. Now, let's say you've been spending your serotonin too fast and you've got 70,000. So you dump that out, you get 700 attached, and it gets yanked back into the first nerve. Well, there's 3 things we can do. Imagine you have a job. You want people to build a fence across the back of your property, and they tell you it will take 10 people a day to build it. Well, only 5 people show up. What can you do? You could give them 2 days. That would help. You could tell them to build a shorter fence. That might get it done. Or you can scrounge up another 5 people. Those are the 3 things we could do. If somehow we could get to where we had more neurotransmitter, and I'm suggesting the best way to do that is to quit spending it. It takes about 3 months to change your habits, and they take about 3 months to fill up the neurotransmitter bank account. But it's hard to do that work if you don't have enough to get started. So you take a medicine, and most of our medicines slow down this take-back pump and give it some more time. Well, let's say you take enough Prozac to increase your attachment here to 900. It doesn't work. You got to take enough to work. It's the weekly average that counts. So if you miss 2 doses a week, that probably won't work. So When you say, I tried Prozac, it didn't work, did you take a full dose, at least 60 milligrams? Did you take it every day? And did you take it for a minimum of 2 weeks, but usually probably more like 6 weeks before you give up? If not, you actually didn't try that. Now, if you quit it because of bad side effects, that's another story. But so often people quit because they didn't give it a proper try. And so the medicine props it up. It's important to know too that if you get, imagine if you will, a cart that needs 3 horses to pull it, a big farm cart. The horses are thirsty and they're hungry. Cart's not going very well. So you give them a little rest and you give one of the horses food and water. The cart will move better, but it's not going to move right. And that horse is going to get tired. So one of the things that we need to do is we need to get the serotonin going, but if possible also the norepinephrine and dopamine. So it's useful to know that quite often your doctor is going to need to combine things. You say, well, isn't there one medicine that works in all 3? Yeah, there's something called MAOIs, which if you eat cheese, you die, which we don't trust you not to eat cheese, so we don't like to give it to you. But should be kept in the back of your mind because very effective medicine. And that works in all 3. It works differently, actually. It gets you more neurotransmitter in the first place. There's another one that works on these second nerves that causes them to be easier to trigger. Instead of 1,000, maybe 800 would work. It works to make the receptors easier to trigger. That's called Remeron. Great for old people because they need to sleep more and eat more, and boy does it run the appetite up. Most people need some sort of combination, maybe something that works on serotonin and then something like Wellbutrin that works on norepinephrine and dopamine. So that's why you need to be patient, keep track of what's been done, and work with your doctor, because otherwise you'll think you've tried it. Like I see people coming in and they were started on Prozac and it didn't work. So they moved to Lexapro. That's fine. Because sometimes, even though 2 medicines both work on serotonin, one will work when the other one didn't. We're not entirely sure why. But then they go to a third serotonin medicine, Celexa. Well, Celexa is exactly the same molecule as Lexapro, so it's not likely to work. And then they might throw in some Effexor, but the dose is too low. So you come to me and say, well, I've tried all these different things. No, you haven't. You basically tried one, a serotonin reuptake inhibitor. And it's important to know that there's a lot of other things. You can get triple action. There are things that you add to it to make it work better. You've probably seen the ads for Abilify. Well, the whole group of medicines similar to that make the other work better. So be patient, but be persistent. I find patients make 2 mistakes. They quit too early or they're patient too long. I was talking to a patient the other week, said, well, I was on Prozac for 15 years. I said, oh, so it worked really well for a long time, just quit recently? Says, I don't think it ever did work. So for 15 years, they're taking medicine they don't think is working. Well, that doesn't make any sense. You got to help your doctor help you by reporting what is better. Like if you take Prozac and you find that you're calmer, but you can't concentrate, you got no energy, that wouldn't be unusual because it doesn't help norepinephrine and dopamine. So you need to report what is working, what isn't working. Before you go see your doctor, you need to write down the benefits, the side effects, what isn't better, and how much better is it. And very often, they can adjust things. For example, if you take Prozac, Zoloft, Paxil, Celexa, Lexapro, Effexor, or Cymbalta, what happens? You dump the serotonin out, and the take back is slowed down. You leave it out longer so it can get the job done. One of its jobs is to ruin your sex drive, but also ruin your drive to learn French or go for a walk in the woods or go fishing or read a good book. You just barely get by. I've had so many people stop their medicine because it robbed them of personality. Why didn't they go to their doctor and say, this stuff's robbing me of personality? I assume they think there was no option. There is an option. You can decrease the medication and add something called Buspar to it, which makes this one easier to trigger. There are things your doctor can do, but only if you report to him what is better and what isn't better, so that he can understand and adjust accordingly. So, just to wrap up, we've covered a lot of things that you have to, I hope you're not overwhelmed. I want you to understand that any movement in the right direction pays off. If a person weighs 300 pounds and they lose 20 pounds, do they look fat? Yes, of course they do. They're still 280 pounds. But are they healthier than they were at 300? Yeah. If you quit smoking a month later, can you breathe like someone who never smoked? No. But you know you're a whole lot better than when you were. And even if you cut down from 2 packs to 1, be patient, be persistent, keep working at doing your part. It's a wonderful way to live. I find that you go through the day being focused on the here and now. In the here and now, see both the good and the bad. Do what you can about the negatives and let go of it. Grab a hold of the rest and savor it and pour yourself into life with energy. And then let it go and move on. You find yourself having enormous energy, and everything else that the doctors and counselors do works a lot better. Appreciate your attention.